Hello and welcome to the Integrative Health Convention 2018 online interviews. Today we're going to find out more about children's reflexology from Susan Quayle, who's speaking at the Integrative Health Convention this October on the 13th and 14th this year, 2018. The Integrative Health Convention is an annual convention in London featuring many leaders in their fields of complementary and conventional medical therapies to help people get better through these various healing practices. It's an opportunity for doctors, therapists, and the public to meet, share, learn from, and connect with each other. We believe that true health is holistic and that people get better in more than just one way. We believe we all have so much to learn from each other, and that the Integrative Health Convention provides a stage for this for therapists, for doctors, and for the public. There are, unfortunately, a limited number of tickets available, which can be purchased at integrativehealthconvention.co.uk, and I'll put the link down below. This series of online interviews will help you get to know our speakers, who are leaders in their different fields of health and healing and medicine, and maybe help you decide which talk to attend out of the 36 talks to choose from over 2 days at Integrative Health Convention 2018. I'm your host, Dr. Wong, and I've been a GP for the last 12 years in Devon, and I'm co-founder of Neurolinguistic Healthcare Limited, the organizers of the Integrative Health Convention. Neurolinguistic Healthcare provides courses in advanced communication skills and therapeutic techniques, as well as training in hypnosis for healthcare providers. Today, I'm speaking to one of our amazing speakers who's coming to the 2018 Integrative Health Convention at the Park Plaza Victoria in London this week, the weekend of the 13th and 14th of October, to share with you what she knows and to tell us a little bit more about who she is and what she does and what to expect from her talk at the convention. So this is Susan Quayle, and she's the founder and creator of Kids Reflex, and author of the Moss series of interactive reflexology storybooks published by Singing Dragon. She runs courses all over the UK and beyond, which train instructors to deliver kids' reflex classes to families in their communities and to bring reflexology into their homes all over the UK and all over the world. Her website, and I'll put a link below, is www.kidsreflex.co.uk. Hi, Susan.
Hi, To. Thank you so much for having me.
Hi. Should we begin by letting the audience know a little bit more about yourself, maybe what I haven't covered?
Yeah, sure. So I'm a complementary therapist, and I'm based in Exeter, and I specialise in reflexology for fertility, maternity, and children. Yeah, that's what I do, and that's how I came to create my programme, from working with all the children of the mums that I looked after.
Exactly does children's reflexology involve?
So the Children's Reflexology Programme is a programme that basically teaches reflexology to parents so that they don't have to go to a reflexologist, because in the middle of the night is usually when your child is going to be unwell, and obviously a reflexologist and also a doctor isn't always available. And so we teach them to use simple reflexology techniques that are based around conditions of childhood. So things like constipation, teething, reflux, things like that, really, coughs and colds, so that they can, have something that they can do when they're, panicking in the middle of the night because their child is unwell and they're thinking, oh my God, who can I do? What can I do? Who can I call? And they can just, use some lovely gentle touch therapy to support their children. And we see that it's incredibly beneficial. Reflexology is a very relaxing therapy. It works on the central nervous system and promotes homeostasis. So it's very stress relieving. So it has huge beneficial potential for parents all over the world, really.
I'm sure many of our parents know what reflexology is, but can you explain to the people who don't know what reflexology is, what it exactly means?
Yes. So reflexology is the way that I have been taught reflexology is based in zone therapy, which is a set therapy that was created by a doctor called Dr. William Fitzgerald. And it basically maps the body on the feet as a reflection on the feet and the hands and the face. And by manipulating the feet, the hands and the face, but I particularly, in my program, I use the hands and the feet, and more specifically the feet. By working different areas on the feet, you can actually have an effect on different parts of the body. And it might sound really woo-woo, but it actually is incredibly powerful and really, really does work. It's amazing. And we are seeing great research coming out now in the reflexology world, for lymphatic drainage, for pain management, in cancer, and we see fantastic things in our program all the time of how it's supporting parents and children, even sick children. So it's really quite amazing. Yeah, a simple touch technique that has incredible power behind it.
Brilliant. And very safe as well, which is why you can teach parents.
Very safe, totally non-invasive. It's very safe, and we don't teach parents everything. It's a very simplified version, just some very core basic techniques, that, I mean, so that we can work quickly with children as well, because children don't want to necessarily be hanging around for ages. They want to be got off, because the thing about what we do is we don't only work with children when they're ill. We work with children all the time, because of course it's so powerful and so brilliant. You don't need to do it only when they're sick. You can just do it as, like, part of their everyday well-being. Really, it's just great.
It's a great skill for parents to have and to learn, and they can have for the rest of their lives, can't they?
Yeah, and I actually really strongly believe in complementary therapy life skills for parents, because I think that's the way forward, really, with healthcare for all of us. I think that in other cultures, these skills are already in the families and they're being used all the time, beneficially. So I think that, yeah, it's really important.
Great. Because I was talking to one of our other speakers, Kush Kumar, who does Indian head massage, and he was telling me how he learned it from his grandfather.
Brilliant. Yeah. Well, the Indian culture is very good, isn't it? Because they have that whole massage is all, that's where baby massage came from, really, isn't it? It's like deeply stemmed in Indian culture. So yeah, so our program is a bit like baby massage, but of course it's just reflexology, so we don't have to take any clothes off apart from socks. It's brilliant. And of course you can do it on newborns, and you can do it on babies, but you can do it on children of all ages, and you can even, once you've learned these skills, you can even use them on grandparents. So if you've got sick grandparents, or grandparents with dementia, or even like dying grandparents, the children can get involved in the loveliness of the whole deaf interaction, which is really important as well, isn't it? So yeah, there's no age limit, 0 to 100 and beyond, if you're that lucky to live that long.
Right. So I'm always curious what brings someone to be interested in their field in health and healing. Can you tell me how you got interested in what you do, and the story behind how you started doing what you're doing now?
Sure. So I got interested. I started off being interested in herbalism, actually, when I was quite young, and I actually took the route of gardening as opposed to complementary therapy. So I was a gardener for quite a long time, and I trained in landscape gardening and garden design. And then when I had my daughter, because I had problems getting pregnant, so when I had my daughter, I didn't want to. One of the things I liked about gardening was being really dirty, and I was a very dirty gardener. Always covered in mud and really rough hands, I didn't used to wear gloves or anything. So I thought, I don't want that for my tiny, lovely, gorgeous baby. So I stopped being a gardener and I retrained as a complementary therapist. And I started with massage, and then I fell into reflexology. And whilst I was training in reflexology, I discovered that reflexology is really beneficial for people trying to get pregnant and people who are pregnant. And of course, like I just said, I'd had my own fertility journey, and I'd had very medicalized births as well. So once I realized the power that reflexology could have to support women in these roles, I just wanted to train in it. So that's why I went on to specialize. And then, of course, once I was, doing reflexology, I was already doing it on my own children. But then once I started working with these amazing women, I started to go into hospital and offer treatments to them when their baby was just born, so I could see what effects it was having on newborn babies, which was really profound. And sick babies as well in hospitals. They I remember working on one baby who had an infection, and at 5 days old she had to have a cannula and have all these antibiotics, and her mum was really stressed out, so I went and worked on her, and it made a huge difference to her being able to leave hospital. So once I started working with all these children, I just thought I need to teach this to the mums so that they can continue this work. They've had reflexology for 9 months, and now they need to be able to take their baby home and give it to them, carry on giving it to their own baby, because like quite often mums don't often come back after they've had their baby. They're so busy then getting involved in their life as a mum. So that's why I decided to create this program, really. So yeah, that's my journey. Yeah, and I'm loving it.
And in October, you at the Park Plaza, the Integrative Health Convention, we're going to talk about the Kids Reflexology program. Can you tell us a little bit more about that?
Well, I want to share with everybody how these simple techniques can have a profound effect. So I will talk a bit about the program and how it works, and I'll introduce everybody to the characters in my book, because in my storybooks the characters all represent different reflexes, which is how we engage children in the whole process. And so I will be introducing some of the animals to the audience, and I will show them where they live on their hands. And the great thing about having animals involved in the program and as part of the reflexes is that children tend to anthropomorphize animals in stories and in childhood, and they can become their friends and they can visit them anytime. And with our autistic children, we find that they come home and they say, "Mum, I've visited Mouse 5 times today," because Mouse is our solar plexus, and she's particularly good at transitional periods of the day when some children really struggle at school to move from one thing to the next. So I will introduce that, but also I will share some of the stories that we have from parents who are using this program and the effects that it's having on them and their children, how it's changing their lives. So yeah, that's what I'm going to be talking about, and how important it is to bring this program out, not just to parents, but to everybody, really. I think it needs, it could change the face of the NHS. I think frontline services could really do with this kind of stuff.
Yeah.
These life skills that, so that they don't have to bring their children to the doctors for constipation. They can just, work it out themselves.
Great. Home management. I think that's really important.
Yes, absolutely. Well, and I think it's really empowering for parents. A lot of the reasons parents go to the doctors sometimes because they are disempowered. They don't understand maybe how their children's body works, or and how they can support them and help them. But with these skills, they're able to do that, and it really changes the whole dynamic of families and how children even look at their parents.
So having thought about the Integrative Health Convention, where the audience will be made up of doctors, therapists, and the public, where do you see your particular practice fitting in with integrative health, holistic health?
Well, like I just said, I think actually it could fit in all areas, and I think that frontline NHS could be really valuable, a place for this kind of therapy, because I went to visit my sister-in-law earlier, and she was telling me about a program. We don't have a TV at our house, but she was telling me about this program that she was watching on the NHS and about paramedics and ambulances and things. And she was saying how huge numbers of people call an ambulance or take their child to A&E for conditions that actually don't need to be treated in these ways. And that's also a sign of the disempowerment of people and how disempowered they feel in taking care of their children. And I think that if this was taught in every surgery, if this was taught to every parent in maternity units before they leave the hospital, teach them these basic skills, I think it would change the face of healthcare, really. If they were taught baby massage and reflexology, it would be amazing.
Yeah. Absolutely.
So yeah, I think that it's a really serious consideration. I think that needs to be, considered. Too many considers then, sorry.
Yeah, no, absolutely, because we see a lot of constipation and reflux symptoms, which maybe complementary therapies can help.
Oh, absolutely. Well, we see it all the time. Constipation particularly is really amazingly affected by reflexology. It's just 3 sessions usually and it clears. My daughter had a friend who came to play when she was about 7. They were about 7. They were at school together, and this little girl had been constipated since she was born, and her sister said she's got a reward chart, and I said, oh, what's that for? And she said, for going to the toilet. She gets £5 every time she goes. So I thought, well, that's interesting. So when her mum came, I said, would you like me to give her some reflexology? So she came, and she had 3 sessions, and she sorted that out. It was sorted out after 3 sessions, and that was a thing that she'd had from birth, and she was taking medication for. And we had a discussion about her diet and stuff as well. But 3 sessions, and what she also said, this child, was that when she went home and she did go for her poo, it didn't hurt, which was really extraordinary, because obviously constipation can be very painful for children, which is what puts them, makes them afraid to go in the first place. So
absolutely.
So, yeah, really amazing stuff. So Toe, let me into your surgery. I'll come and we'll do a pilot scheme, shall we?
We can, absolutely. I'll talk to you about that later. So
you might want to edit that bit out.
No, I'll have to. Okay, I'm asking one particular extra question. As a therapist or teacher with years of experience, what do you think in particular is the key to healing in what you do? So I'm looking for something personal as to what you think you do that makes the most difference.
Okay, well, what I think, there's a few things, but what the most important thing is love and caring. Okay, so that's the most important thing. When people come to me, it's all about them, and in that time that they're with me, I have never worked to time, so I give people what they need, and when I'm working on their feet, I work according to what their feet are telling me, not to what the clock is telling me. So that's the first thing. But also, I think what's really important is that by doing this program, creates super parents. So it gives parents superpowers, and that will sound really silly unless you're a parent who has done this course, has been on this course, and has received these life skills, and has given them to their child at a time when they're ill, and has seen the look on their child's face, because it's priceless. There is nothing like it. So that's the thing.
Oh, great. Thanks a lot. So thanks for taking the time to take your time out for this interview, and thanks for the audience for watching this. So remember, everyone, to get your tickets early from our website. We are the Integrative Health Convention in London on the 13th and 14th of October 2018 at the Park Plaza, Victoria. You can use the discount code podcast10, which I'll put down here, and this will give you a 10% discount as a gift from us to you for sharing your time with us. So when we see you in October in London, you get to meet myself, Susan, and all our other amazing speakers out there, and I really hope I could attend every single one of these talks. Remember, there are so many of them, the 36 different ones. So you'll be able to attend 6 talks each day. And there are 2 days that you can choose them over, and we've got videos. Come and watch them and come and join us. Thank you.
Thank you, Toe, for having me. I can't wait.